All right, free help is available for the Affordable Care Act. If you have questions about signing up and you want to talk through your options like Josh was talking about, here's that 800 number. We wanted to make sure that you have it, 800-318-2596. All right, we are back with Dr. Catherine Sevier and Josh Peck answering your Affordable Care Act questions and your Medicare questions as well. All right, here we go. We have a whole slew of things to go through. This person says, I'm already enrolled in Medicare. Do I need to do anything? I'm 86 years old.
No, you don't. Unless you want to make a change in your supplemental plan, you are good to go. Just keep track of your card and make sure that you always let your provider know what your enrollment number is.
Okay, the next question is, can you get ACA coverage and be enrolled in VA healthcare at the same time?
Yes, you can. VA healthcare is available, and there's different levels of care that you may be eligible for. So having other healthcare insurance may, depending on what your VA benefits are, be advantageous to you. So you need to understand your VA benefits and work with a VA counselor to understand what you're eligible for.
All right, this one is for you, Josh. This person is saying, what exactly do I need to sign up for the ACA?
You're going to need some basic household information, the names and social security numbers of every member of your household. You're going to need to be able to estimate your household income for 2021, and you'll need to attest to your citizenship status and a couple other sort of basic things. So you don't need too much. Social security numbers are usually one of the most important pieces of information to collect before you apply, and just basic information about your household.
Okay, this person says, I'm about to turn 65, but plan to keep working for 2 to 3 more years. I have full family insurance coverage through my company, and I contribute with an HSA card. Can I delay signing up for Medicare until I retire?
No, you cannot. And you don't want to, because you will pay a penalty. You can, now this is where you're going to need to make sure you get some counseling. If you work for a company that has more than 20 employees, and you have a group plan, you can use that group plan as your supplemental. But if you work for some programs where you don't have more than 20 employees working for them, you may not be able to have your group coverage be your supplemental plan. So you want to talk with your employer about what your benefits are. And then you will want to check with Medicare as you're signing up, but you must sign up. And you want to make sure you sign up for Part B, because if you do not sign up for it at the beginning, you will pay a penalty later.
Okay, so you enroll in Part A, but you also have to sign up for Part B.
Or you have to prove to them that you have a qualifying plan. Otherwise, later, when you try to sign up for Part B, you run into that penalty we were talking about earlier.
Okay, you know what? We have a graphic that explains Medicare Part A, Part B, Part C, Part D, the supplemental, all of this kind of stuff. So let's put up that graphic now so that you can kind of go through it and just kind of give me the 101s, the simple explanation of what each one of those is.
So Part A is hospital. And if you are in the hospital and discharged and need to go to a nursing home, there is some limited coverage for a nursing home if you meet qualifications. Part B is think outpatient and think your doctor's office, your consults, your specialty care in the community. Part C is when you look at going into a managed Medicare product where everything is managed through that program, including your pharmaceuticals, and sometimes it has other things attached to it like dental insurance, silver sneakers, that kind of thing. Part D is all about medication. So Part D is where you pick a drug plan that helps to supplement the cost of your medications.
Okay, that was a great explainer. Thank you. All right, what we're going to do is we're going to go to break quickly and then come back with more questions, including this one, Josh. Someone says, why is there even an enrollment period? We're going to talk about that next.